Welcome to the Trinity Health IHA Medical Group Wednesday Wellness Series. This webinar is titled Strong from the Inside Out, Pelvic Floor Preparation for Pregnancy and Beyond. The presenting providers are Trinity Health IHA Medical Group Certified Nurse Midwife Jennifer Kelly and Certified Integrated Manual Therapist and Pelvic Health Program Director Jessica Wien. One sees patients in our Domino's Farms location in Ann Arbor, and Jessica sees patients in Ypsilanti. So welcome.
Thank you.
Hey, everybody. Thanks so much for joining us at this multidisciplinary talk about pelvic floor health and related to pregnancy. So, as Allison introduced, I'm Jennifer Kelly. I've been a midwife for 21 years, 11 years here at Trinity IHA. I've been the clinical site director for Domino's Farms Midwives for the past 4 years. I live in Van Buren Township with my family. My husband, Brian, is an attorney there, and he is on the board of trustees. And I have 2 kiddos, Grace, who is 13, and Luke, who's 11. They're very active kiddos, and the main sport that our whole family is really involved in is flag football. Brian's a coach. I manage the teams, and we are just every weekend, you know where we're at. We're on the field somewhere. I'll go ahead and kick it over to Jess to do her introduction.
Okay, hi, I'm Jessica Wien. I'm a physical therapist, and I've been a physical therapist since 2009, but started working with pelvic floor patients, pregnancy, postpartum, and you name it, including urinary incontinence, urgency, constipation, all those things since 2011. So I've been doing it for a really long time, and I love it, and I love making a difference. I also am married of 17 years and going on 18 this year. And I have 2 wonderful children, a 9-year-old and an 11-year-old, that I was kind of informing Jen that I was like hurrying, trying to get one to swim practice to make it to the talk today. So I feel fortunate to be here, and I hope that we provide something of use for all of you today.
So Jess and I were working on the first of what would become many projects together when we realized how well our specialties complemented one another and how much our patients could benefit from future partnerships. Together, we've developed patient handouts, we've expanded our practices knowledge of what the other can offer to their patients, and we've developed lectures for providers and now for patients. October was National Physical Therapy Month, and just last week was National Midwifery Week, making this a perfect time to highlight a topic that's relevant to our respective fields. With that, I'm going to turn things over to Jess.
All right, here we go. Hope everybody's ready. Buckle up. Here we go. So here for today, the purpose of today, like Jen said, is to kind of work together and give you kind of what you may need right before you deliver, and then what you need during delivery, and then hopefully kind of guide you on what you may need or options for after you deliver. So pregnancy, childbirth, and postpartum care. Okay. All right. So the pelvic floor protection during pregnancy. So we'll talk about staying active, walking, swimming. I'm a very big runner. So I love to be active and love to be out of there. So it's okay if you've been running now, it's okay to continue to run throughout this time period. I encourage you to swim and walk. And I also tell my patients, if they're really big runners and they're very hard on themselves, like maybe I may have been in the past, it's okay. It's okay to think of it as your off season at this time. And but finding a form of activity during this time is really important. And Jen's going to talk a little bit more about it.
So let's talk a little bit about safe exercise in pregnancy. So first of all, there are so many benefits to pregnancy with having participating in regular exercise. Things like decreasing the risk of many pregnancy complications, including gestational diabetes, hypertensive conditions, perinatal mood disorders. It helps promote a healthy weight gain for the mother and normal fetal size for your baby. It helps with sleep and energy. It prepares you for labor, speeds up recovery, and decreases C-section rates. How could you not want to exercise, right? We recommend that you aim for about 150 minutes of activity per week, but trust me, I know some people can't get to that point. I know in my busy life right now, I don't always get to that point, but my cat is visiting, sorry. Any amount of activity is better than none. So don't feel like, oh, I'm never going to hit 150. What's the point? Any activity is beneficial. If you have any high-risk conditions that might make you more high risk for exercising, things like placenta previa, risk for preterm labor, hypertensive, or cardiac conditions, please check in with your provider before starting up exercise. In general, with exercise, you want to watch your intensity level. We usually tell people if you're able to remain conversational without getting breathless, you're at a good intensity level. You also want to be safe. You want to avoid contact sports, things like soccer, volleyball, where things can strike you in the belly. You also want to avoid things where there's a high risk of falling. In pregnancy, your center of balance really starts to fall off, and much sooner than you might even believe or expect. So things like skiing, bicycling, rollerblading, those are on the no list for the pregnancy. You want to avoid after 20 weeks being flat on your back. You want to avoid heated exercise environments and make sure you're staying adequately hydrated.
Me.
You.
Here we go. So here's kind of sometimes I love this slide just because I'm sure Jen has heard this a billion and one times, and I've heard this a lot. These are kind of normal things that we would hear, maybe for a patient following their delivery. So I am here to tell you that maybe because you've heard these comments before, they might be a normal, but they don't have to be your normal. And Jen and I are here to provide help for you if you need it. So little things that I've heard is, so I pee when I laugh. That's normal, right? It just happens after a baby, right? It's normal part of aging, right? So these are common things that I would hear on a normal basis, but it really doesn't have to be your normal. If you hear it, know that there's providers out there that want to help you. All right, so my big thing is I love to talk about the pelvic floor. Most people don't know, and I'm sure you know why. The pelvic floor is going to be at the bottom here, between if you can see the pubic symphysis is kind of labeled in the picture, and the sacrum. And in between is those are your pelvic floor muscles. So those are the muscles that need to kind of let you have a baby, right? So things may occur during that period of time. But, in my world, we always are worried about the transverse abdominis because that's also very important with a C-section, as well as multifidus and the diaphragm on the top, which is your respiratory organ or muscle at the top. So the pelvic floor itself kind of forms a sling or a hammock down at the bottom. And its main job is to kind of keep all of your organs inside, and it helps to keep you continent. So it prevents any type of leakage. You can see that it provides some type of stability to the pelvic floor. And I do see, and it is very common that if you have back pain, that there's a high link between pelvic floor dysfunction and lower back pain. So we do see quite a few individuals that are referred to us that ended up having their driver of their back pain being their pelvic floor. And then also it's big on sexual function, right? So this is a pretty important muscle for any type of sexual intimacy. So I think it's fair to say that these muscles are very important. And we're here to talk about them with you if you need to talk about them. So some people don't really like to talk about them, but Jen and I all day long, we'll talk about them. So. All right, and I unfortunately missed it to stand there, so but we'll fix that next time. Lifting, so things to think about with pregnancy right now. I like to say when you're lifting at any point or going with sit to stand, you want to exhale with the effort or blow before you go. These are kind of common things as you're moving through, because the idea being is now you have a lot of extra pressure from the baby on top. So using your breath as you're transitioning, especially as you get bigger, one will make the effort a lot easier for you. And two, you'll decrease pressure onto the pelvic floor, which we're always trying to protect the pelvic floor over a period of time, just because it does hold all your organs and it keeps you continent and it has really big sexual function and stability. So, as you work with things, especially after the baby is born, exhaling with the effort, if you can remember anything, is really important. So as you lift your baby, as you go sit to stand, those type of things, it's really important to remember exhale with the effort. Sleeping positions. So common things that we will go over in our clinic is just we'll bring all the pillows in. We'll put you in one position and say, hey, what does this feel? But some of my patients love the pregnancy pillows and swear by them. And then I have some that don't, and Jen might say otherwise. But in general, we try to get enough pillow that you can lay on left or right is kind of the recommended sleeping position. with the support underneath your cervical spine. But you do, because of like some things that can happen with your hands later, it's kind of advisable not to do this sleeping position where you're putting your arm up overhead. Some people get numbness in their hands and things like that. So if you can kind of bring your arms down and drape them over pillows, that's probably ideal. And then other things is trying to put a pillow underneath your belly really helps with like the lumbar spine neutral. So I have people like play with how many pillows they put under their belly, how many pillows they put between their legs. There might not just be one, it might need to be two. I've seen people with like 3 underneath their legs. So wherever you can find, this is the time that we want you to get rest and get ready for the big day or the big game, some people would say. So whatever position you can find comfortable is recommended. Okay, so pregnancy binders are a really common question for us, and what's like the best binder? So some binders, there's some belts that are out there that are really just made and designed to like stabilize your pelvis, and those sit underneath your SI and underneath your belly. Now, the picture I have here is a true pregnancy support, and that is really helpful for unloading the back. So if you're getting a ton of back pain, these type of the mother belts and the better binders and the prenatal cradle, the whole point is to kind of lift your belly so that, because what happens with pregnancy is you start to go into an increased lordosis. Those belts kind of help lift your belly so that you're not kind of pulling forward onto your back structure. So it gives you some support. They've done some research on it, and it appears that they are effective for low back support and pain. So it might be worth a gander to see if you're having a lot of pain, looking into some of these pregnancy support options. And I'm sure, Jen, do you have some of these handouts in your office for pregnancy support?
Sure, we do.
Yeah. If not, I have some. I'll send them your way.
Great.
As far as
See, the sharing just continues.
we caution probably heels and flip-flops. I'm not going to say anything shocking there. However, do get, if you're like, I can't bend down to put my shoes on, and you put some flip-flops on, I'm not going to say anything. Okay. So, but recommended having some type of good arch support would be really good as well. And then the other thing is like compression hose and garments. There is some research on those. You can wear them. I think they recommended 20 to 30 milligrams or so. I'm sorry, that didn't come out right, but just a basic one that you can find out Walgreens is the recommended brand that you can wear, and you can wear socks over them and things like that. But signs that you might need that would be wrinkles or bunches in your, like when you take your socks off, there's like a big blue line or a divot that you're really swollen. That's normally a sign that you might need some type of compression or something along those lines that might help you throughout the day. All right, so common things that, during pregnancy we might see. So we would start to instruct you on our bladder habits and bowel. One, we just kind of want to get you an idea of what normal bladder and bowel is like. Bladder habits might change a little bit with pregnancy. Right now, there's the weight of the baby that's on top of your bladder. So don't be too hard, but normal fluid intake should be half your body weight and 2/3 of it water is typically what we recommend. But it can be more right now during pregnancy as you're making things, right? You're burning lots of calories per day. Feel free to drink lots of water, but that also means you might be going to the bathroom. So normal voiding per day is about 5 to 8 times per day. There are things like bladder irritants, like coffee, and I won't lie to you, chocolate's a bladder irritant as well, and tea, and some other things that can be irritating. So if you're noticing a lot of urge to go after you intake some of these irritants, obviously you're not going to be drinking wine, but the options are, coffee is a normal one that I would hear, and some teas that people really like to drink. And then even your LaCroix, those are sometimes irritating towards the bladder. So we kind of say, look out for those. If you're having a whole bunch of them and you're having to go to the bathroom at that time, that's probably a bladder irritant. JIC, J-I-C, that means just in case voids. So those are the times that you just went to the bathroom, but you're going to Walmart or a store and you have to go. You just decide to go because you're going to be in a store. We try to say, don't kind of get into these your bladder likes to fill and void at a certain rate. So try to avoid these just in case voids if you can. Otherwise, you're feeding into a signal that's not quite there, and your bladder likes to become the boss of you a lot. I like to use the analogy that your bladder is just like baby Jack Jack. So if you give it a cookie, it will continue to be like baby Jack Jack, and it will continue to want another cookie. So the more you can kind of avoid those just in case voids, that's a good idea. Bowel. So fiber, 25, lots of fiber. There's lots of really good resources out there for what is really good fiber. 25 to 35 grams is approximately correct. It depends on age, height, weight. So our kids will obviously need a little bit less fiber. As you get a little bit older, it changes on what the needs are. Toileting, normal bowel movements are 3 times per day to 3 times per week. That's a big, broad range. So with pregnancy, though, we know that your hormone levels are changing in a such that it's slowing down your smooth muscle tissue. And most of the time we hear that a lot of people get pregnant, like constipated with pregnancy. So that's time to talk to like Jen about, hey, what can I do about this? I'm slowing down. What can I take? A lot of times water, fiber, a nice active lifestyle and some vitamin D can get your bowels moving pretty good. Who would benefit for PT and pregnancy? Worsening our new stress incontinence. That's definitely somebody that we see. Any pain with intimacy related to the pelvic floor. That is really common, especially postpartum, that we see a lot of gals. And then pain and around the groin with transition. So a lot of people will say, oh man, I have pain right at my groin or right at my pubic symphysis, like right where the bones attach as they go into sit to stand. Those are common things that we call that SBD pain or pubic symphysis dysfunction. So it's a pelvic girdle instability essentially. And that's where we come in and we are very helpful. I just evaluated somebody today that she's like, I had so much pain in my pubic bones during pregnancy, but had no idea that I could come to see you because I'm seeing her postpartum right now. So those are some people that I would normally see, as well as like people with back pain, SI, discomfort in the lower back, which is at the tailbone. Those are common things that we would see. So Kegels, helpful hints, holding back. So there's a couple cues. So your pelvic floor itself, I think this is really a helpful hint for everybody. Your pelvic floor itself is a sprinter, but it's an endurance muscle. So which means that it has to be able to contract quickly so you don't leak when you cough, laugh, or sneeze, but it also has to hold all your organs up. And now it has a baby to hold up. So it has to work differently. That's why we don't just give Kegels, we give different types of Kegels in order to help promote and strengthen. And there's lots of research out there that says, yeah, this pelvic floor contractions might help with labor, maybe not incontinence during pregnancy, but like afterwards, it might help the pelvic floor muscles, which will then help with your labor. So helpful hints for performing a pelvic floor contraction include holding back gas. My favorite is if you pretend like you're sitting on a small green pea right now or a blueberry and you're trying to pick it up towards your head. That is my favorite cue. Some people really like the claw hand, those claw hands in the toy machines that pick up a toy. Those are really good cues too. They really like the claw hand. I've lost a lot of money on those machines with 2 small children. And then pretend like you're stopping the flow of urine is a common one. We always say, you can practice that on the toilet maybe once or twice, but don't keep on doing it because that's not normal voiding mechanics. Or you can use things like a mirror if you're feeling comfortable. We have a lot of people when they're starting Kegel contractions, like sitting on a small towel and pretend like they're picking up the towel to give them some proprioceptive feedback. So those are all ways to do Kegels. Jen.
So we already talked about the benefits of exercise for pregnancy, but exercises also can have a huge impact on labor in the pushing stages. So during pregnancy in general, it can be helpful to spend some time in some useful positions. For example, it may be worthwhile to spend money on getting an exercise ball, or what we call them in my world as a birthing ball. So just spending time on that in more of a squatting, in that open pelvis position, sitting on it, rocking, doing squats, or even just sitting in a squatting position. That's going to strengthen those muscles and get you flexible and comfortable in these positions that you'll utilize in labor. An excellent website that I refer patients to every single day, we're not to that slide just yet, but that's okay, is the Spinning Babies website, just spinningbabies.com. This has a wealth of information. You can really go down a wormhole and spend hours and hours here, but the things that we really want you to focus most on are the daily and the weekly activities there. They have stretches and exercises for birth preparation. And one really helpful thing is if your provider notices a less than ideal position of the baby closer to term, even if the baby's breech, there are guidelines that we find are very safe to follow and can be very effective in helping get baby into a better position. So that's a great website to be familiar with. Now we can go to that next slide. I get a lot of questions from patients on perineal massage. Is that something they should be doing or not? And actually the latest research shows that it can be helpful. It can decrease the likelihood of a laceration. So that's a tear that occurs at the birth of the baby, usually with the head or shoulder coming through the birth canal. So it can help prevent lacerations that need repair, that need stitches, and decrease the likelihood of the need for an episiotomy. That's where a provider needs to provide a cut in the tissue prior to delivery of the baby's head. It does not make a significant difference in pain, postpartum pain, or healing. Warm compresses also can decrease the 3rd or 4th degree lacerations, the most severe ones that involve the anal sphincter. Obviously, we want to try to avoid those as much as possible, but they don't decrease lacerations in general, just the severity of those. In terms of perineal massage, we're not going to walk through the whole thing, but you'll have this slide to refer to. But if you're going to do it, you would want to start around 34 weeks and do that about 3 to 4 times a week. Sometimes partners will assist with this. Sometimes it's something you'll do on your own. We can go to that next slide. At Trinity Ann Arbor and a number of other hospitals, you're going to have a ton of tools that are going to help you with the positioning that can be really useful in labor. Things like in those first 2 positions, you can see the birthing bar. That's a bar that fits into the bed and allows you to get into a squatting position, which is what she's utilizing in the first picture. The picture below that, you can utilize that with a sheet and do a tug of war position with pushing. That can be really useful. These labor beds do amazing things. So just let your nurse show you all the different things that it can do with positioning. We have bean bags. That's what the second on the kind of the middle top picture is. She's leaning into a bean bag to support her body. This is great for restful times after you've had an epidural, or actually great for pushing as well. In those bottom 2 pictures, you can see just a couple of our birthing balls. We have many different shapes and sizes that are really, really useful for getting into different positions. The standard birthing ball, the gray one there, is great for just being in that squatting position and rocking. You can also utilize the toilet. Sitting backwards on the toilet can be very useful, and you can do that at home if you're in early labor. That can be a really useful place to get into that comfortable squatting position. We also have hydrotherapy that you can utilize on labor and delivery, either the showers or the tubs. Our labor rooms are one or the other. You have to choose which you would want. So what you want to do is think about that, maybe talk with your provider to see if there's any limitations of whether they'd want you to be in the tub for laboring. And then if you have a strong feeling about that, make sure you're letting your nurse know before you're admitted from triage so they can put you in the appropriate room as long as it's available. So we can go to the next slide there. Optimal positions for labor in general, especially early in labor, we really like you to try to utilize upright, forward-leaning squatting. These positions are really going to utilize gravity, which is going to help the baby move down in the pelvis. Things like squatting on the birthing ball, like I said, the toilet, like I said, can be really useful while laboring. The standing position can be really useful, like seen in that first position where you are leaning on a support person, kind of doing some swaying. They can provide some pressure on your back, some counter pressure. We've got the bean bags there. So things like being upright, forward leaning, like into the bean bag, being on your side, So if you're someone that's planning to utilize an epidural, we really recommend that you try to utilize these positions early in labor and take advantage of those before you get the epidural, because once you get that, you're going to be in bed. But if you do get an epidural, don't worry. The nurses and midwives can still utilize a lot of really good positions that are useful in helping the baby get into the optimal position and keep moving down the pelvis. And your nurses and midwives really are experts at what specific positions might be useful for your specific labor. So we'll give you lots of guidance there. We can go to that next slide. When we're talking about optimal positions for pushing and birth, variety really is the best. We never know exactly what position is going to work best, especially first-time moms. Sometimes you've got some time of pushing ahead of you. So by trying different positions, we can see what's going to help that baby move the best. We'll have suggestions for you. We'll encourage you also to do what feels right for you. You may have done some research and had an idea of what feels good. Some positions just won't be really comfortable if you've got sciatic pain or things like that. So we'll definitely work around those kinds of things, and we'll absolutely give you feedback on what's working well, maybe what's not. Sometimes too, babies might not tolerate, their heart rate may not do well in certain positions. So we'll be flexible with that as well. But our goal is to help you be the most effective with your pushing based on those positions to help shorten the total time spent pushing. To look at those pictures, just to give you some ideas, we've got that birthing ball again, that birthing bar in a couple of those positions where you're doing the squatting position in that bottom middle, that first picture where she's doing that tug of war. The top last picture, she's in that sideline position. You also can envision that traditional position that you'll see where people are on their back, bringing both legs back. That in the sideline position will often have support people really helping support those legs. So you're not doing all the working of pushing and supporting your body. We'll be supportive of that for you. And then again, hands and knees leaning into that ball. So there's a lot of positions that can be really useful for delivering, and we'll try to utilize a variety of those. If we go to that next slide, we are going to do everything we can to try to minimize trauma to the vaginal tissues with delivery. We may utilize warm compresses and lubricants. As we said before, those can really help decrease the extent of tearing that you may have. When it comes to crowning, we're going to provide some support to the tissues to try to really minimize tearing as well. And we're going to guide you on how to push. You're going to get instructions on how long, how hard, small, gentle pushes, things like that, so we can really have a controlled delivery of the baby's head and shoulders to minimize that trauma. We're going to also guide you through how to breathe, how to push, what's working. Sometimes we'll utilize pushing every other to give baby a break with recovering their heart rate. So we'll give you lots of guidance, but those are some of the strategies that we utilize to try to minimize injury to those tissues, but also to help speed the process along for you as well, because it can be very tiring. I think it's back over to you now, Jess.
All right, so I'm happy to report I am not in the hospital, but we have I have a friend. Her name is Priya, and Jen's friend. Jen and I have a friend. She's like the inside. She's the one that will look out for you. If there are any issues, Jen is like right there talking to Priya about what they can offer you. So the cool thing is there's somebody in the hospital now just for like postpartum and pregnancy that can take care of you. So any of my patients, I'm like, look for Priya if you have any problems. So it's very lovely to have these providers in our hospital now. So they provide long-term hospital care, especially if you end up being in the hospital for a longer period of time. But they also are available. I think she sees most all C-sections when they're delivered, and grade 3-4 tears, I think she makes rounds on to make sure that they're seen. As far as what we see, we normally see individuals about like 6 weeks for if they need pelvic floor work. That's at that point you've had a follow-up if it's a vaginal delivery with your provider. And then you're cleared for any internal exam that we might perform. However, with that being said, if you're in significant pain and Priya says, hey, I need you to see them sooner, we will absolutely 100% get you in way sooner than 6 weeks. And we actually are recommending, if you want PT sooner, maybe talk to your provider like when you discharge, so we can start getting the referral process going so we can see you at a sooner rate. Because Once you go back to work, that's when it gets a little trickier to manage, like baby, life, kids, and all the things that we have to do in our lifetime. So we tend to see tailbone pain. I've had a few people that had some issues following delivery with tailbone pain. Post C-sections, I definitely recommend coming in. Just because now that tissue, like they have to go through the transverse abdominis, if you remember me talking earlier, and that's part of your inner canister. That's with your diaphragm, your pelvic floor, your transverse abdominis. That like holds all your organs in, and that muscle is a pretty big deal. So we kind of recommend coming to see us so we can help you with transitions and caring for your baby. I like to say that we treat our moms for the game, get them ready for the game, because those car seats are not light, and they're not getting any lighter as the baby gets older. So post-cesareans, third and fourth degree lacerations, bladder incontinence, and difficulty voiding. I've had a few people that have had issues with catheters and coming to see us, and then getting kind of normal habits going following catheter utilization. And then greater than 3 hours of pushing are a really good time to come and see us as well if there's some issues following. First step. So the first thing you need to kind of know is that you need to rest, right? You just ran a marathon, if not like 5 in one day. So I think it's, take your time. You're off season right now. Take time to heal, be with friends, let your mom help you if she's willing to, and your friends cook meals for you at this time. Minimize stairs. You don't need to be going up 101 stairs at this time. And then breathing is a really good thing to learn, and any practices that you've had with breathing, whether it's slow breathing, parasympathetic breathing, box breathing, all these different types of techniques are really helpful during this stage, as well as learning how to relax your muscles in your pelvic floor, because it just went through a significant amount of things. Postpartum technically is labeled for the first 0 to 12 months, so the first year. But I argue that once you're postpartum, you're always postpartum. So I always joke that I just had a baby, but she's, my baby's 9. So, but I'll just throw that out there. Once postpartum, always postpartum. What you'd endured when you had a baby doesn't necessarily go away. And that I recommend, if you're still having issues, even at 9 years postpartum, just still talk to your providers about it. Body mechanics. So lifting baby. So again, that's where the exhale with the effort is really huge. So making sure that you keep baby close to you as you lift him. Obviously, center of gravity is really key. And then trying, at the bottom it says prioritizing symmetry, which means that like most of my moms, they're right, as the baby gets bigger, they're right-handed. So they will hook baby on the left and do everything with the right, and then all of a sudden we notice all these asymmetries occurring, or back pain, because they're always doing the same thing over and over. It's kind of similar to, some of your linemen or your people that work at factories, and they do the same job over and over again, and they get these repetitive things. Same idea. The baby's heavy. You're lifting them constantly. So just try to be symmetrical. If you put the baby down on this side, put the baby down on this side, sometimes to change, right? So try to stay symmetrical. As far as breastfeeding and baby, we always say bring babies to your chest, okay? It is, I find even when I had a baby, I was so nervous about having the baby latch to me that I'd cradle my body and contort it into every position to make sure that I get to the baby. But here's the thing, you're going to be nursing anywhere from 15 to 30 minutes approximately, maybe less, maybe more. Everybody's different, right? So if you're doing that 5 to 8 times per day and you're in a contorted position every time, it probably is going to wear on your body. So try to find a way to bring baby to you the best that you can. Now, there are things like, look out for, blocked milk ducts and things like that, or mast, like if they feel red or firm, that's like always good to follow up with your providers to make sure that that's taken care of as well. And then when you are nursing, really important, because I get a lot of gals too, they're trying to hold the nipple to help with the latch. That's really hard on your wrists. So making sure that you're not overcompensating through your wrists. And if you need to, there's splints and stuff out there, but I've had some gals when they're trying to nurse their wrists and their fingers start to hurt. So watch your hand placement as you're doing that, as well as once you get baby to latch, maybe think about doing some shoulder squeezes, looking up, doing some rolls, just to kind of make sure that you're not hunched over. over a period of time. Other things that people find helpful with the C-section are abdominal binders in particular. I tell people don't rely on them forever, but they are a nice option if you're feeling like you're getting a lot of pain through your abdominal wall and you need some comfort. Those abdominal binders are quite nice. They just kind of wrap around from the front. Jen, do you have those in the hospital? Do you give those out?
Yeah. If patients are interested in them, they can. I don't know if they routinely give them to everyone, but quite often patients do have them. If you haven't been offered one, you can just ask for it.
Perfect.
I don't think it's a must do, but it's certainly available.
Yeah. So we don't say we use it forever, but it definitely certainly it can be helpful during that period of time, that first initial healing period. All right. We're moving through. So postpartum healing, these are like the early, easy movements. We don't really want to do a ton. I gave you a handout with these exercises, so we won't review all of them. But diaphragm breathing is kind of that basic inhale through the mouth, make the belly big, exhale, make the belly small. That's diaphragm breathing. That's a really great one, especially for the diastasis recti. That's a great exercise for that, which is the separation between the six-pack muscles. That has been researched to be effective for DR retraining. Your pelvic tilts, just gentle rocking back and forth. Those are really helpful. It doesn't have to be this huge activation pattern, right? You're just moving your pelvis a little bit. Core activation. So the general thing for a TA brace is pretend like you're putting on a tight pair of pants. That's just like bringing your belly button to your spine. That's a gentle activation. And that is really helpful as you do some of your transitions, along with the blow before you go, or the exhale with the effort. So you can, as you blow out, you're getting a little bit of that pull in of the abdominal wall, and that protects your core and allows you to transition a little bit easier. Because if you remember correctly, your body has changed a little bit, right? You have potentially an increase in lordosis. The ribs are starting to flare just a little bit more. And pelvis might be wider. And so your new normal hasn't figured out this core contraction yet. It's still kind of working with it. So gentle engagements to start with are always good. Just to be like, hey, we're still here and we still function well, and they're going to help me as I do my transition. And then shoulder blade squeezes are where you bring your shoulder blades together. It's a really easy exercise. It's helpful for, nursing, because most people are cradled in. I actually have a gal right now that she started getting issues with blocked milk ducts because she went back to work, but then she's on the computer all day, but she's not actually moving like her shoulders anywhere because she's on the computer all day. So, and then she's not doing as much. So we've kind of worked with them a little bit more. As I stated earlier, there's different ways to do Kegels, and postpartum, it's good to learn how to do quick contractions because that helps with leakage with coughing, laughing, sneezing, or jumping on a trampoline, which is a big one later in life as the kids ask you, hey, mom, let's go jump on the trampoline. And you're like, hold on, let me go to the bathroom first. Those are the ones that you want to do, those quick Kegel contractions. And then the longer holds, we say holding up to like 10-second holds. 10 reps is kind of like the big standard goal. So hold for 10 seconds, 10 reps. For the quick flicks, we would say do about 5 and, do a quick 5 sets and then relax and do another quick 5 sets. Do that about 5 times. But you'll have this on a handout for you. And then your slow releases, that's a contraction. So you're going to pick up that blueberry and then you're going to slowly release it down. So that's a different type of contraction. So it's not just Kegels, right? There's different ways to train your muscles because your pelvic floor is fast twitch and slow twitch. It's a sprinter and it's a marathon runner. It's very postural and it functions to hold all your organs up, right? And keep you continent. So early postpartum healing, just warning signs to call Jen if you're in problems is pain, heaviness, leakage does not improve. And then pain with intimacy. I do get quite a few gals, and Jen can kind of attest to this. Hormones are different when you're nursing. So, you might be a little drier in that area, so it might not feel quite right. Also, if you had any tearing, it's definitely not going to you're going to be working through a new normal. You'll get there, but that's, we come in to try to help. And that perineal massage that she gave you earlier, sometimes if she says it's okay, you can maybe do that a little bit afterwards for desensitization to help with this area if you had any perineal tearing.
I'll
Yeah.
comment on that real quick. Yeah, even if you've had a C-section, you're going to want to wait until that 6-week visit to really get cleared for vaginal intercourse. We just want to make sure that things are well healed, looking good, and we're going to talk to you about things to watch for. You're going to need some extra lubricants, especially if you're still nursing because of the hormone changes, like Jess was saying. And just taking things slow. I usually tell people just talk to your partner, take things slow. Pay attention to what positions are working, what aren't working, and that there may be times that the first time around you're not going to finish. You may begin and then say, that's it for today. Let's try again later.
And with those people, if you're getting a ton of pain with intimacy, Kegels probably maybe not be your answer. So you may want to hold off on that until you talk to Jen. Okay. So certain people not everybody is appropriate to have a Kegel all the time. So some people need to learn how to relax their pelvic floor too. So I just want to make sure people know that as well. Okay. So when to make an appointment for PT in particular? It's, typically these are kind of guidelines for you if you're having urinary incontinence of lasting 6 weeks. So yeah, you may have a little bit after you deliver. Don't panic. It's okay. But if it doesn't go away after a certain period of time, you should probably follow up with your provider because there are people that really do want to help you. And you're not alone. Back pain or pelvic pain greater than 2 weeks. So yeah, during that first period of time where you're having issues with transition pain, they've done some research. If you start to have that pain during that initial period, it potentially will carry on for the next 1 to 2 years. So it's best to try to get it kind of nipped at that time and try to get it taken care of if you're able to. Diastasis recti. Now here's an interesting, so that's the separation of the 6-pack muscles. So that's, most 99 to 100% of pregnancies get a diastasis recti. So I just so you know, you're going to get one. And it's okay. Most of the time it goes back to the way it was, you know what I mean? But there are some people that just have a little more elastin versus collagen in their system. So it might hang around for a little bit longer. And so we kind of come in to try to help get you as strong as possible, get those muscles working together so that maybe it doesn't affect your bladder, your pelvic floor, or your low back in the long term. Any pain, leakage, a feeling of falling out is a common symptom that we'll hear. So like you feel like the organs kind of don't feel quite right when they're walking, or pressure. I have a gal right now that feels pressure after she's been walking for a mile. So yeah, we're working on longer holds and trying to change your mechanics when she's walking. And then painful intercourse greater than 2 months. Those are kind of guidelines to help you. These are some of our locations. Throughout Trinity, we have approximately 18 PTs and a couple OTs throughout the system, which I think are super helpful. Our OTs are wonderful, and a couple PTAs and ATCs. So we are very fortunate to have this crew of people that I get to work with every day. I'm pretty lucky. So, Jen?
And these are our 2 locations where you can see our nurse midwives at the Domino's Farms location that deliver at Trinity Ann Arbor, and then our Schoolcraft Campus Livonia nurse midwives deliver at Trinity Livonia. We also have excellent physicians that are at all of the Trinity IHA locations. We work really closely with them. They are also fantastic. If you are someone that is more high risk, that doesn't qualify for midwifery care, but was still hoping for some natural things to their labor, to use alternative positioning, things like that, they're very, very open and supportive to that. I've always said it is such a great place to be a midwife patient and such a great place to practice as a midwife. We're very supported.
The midwives are great. I will attest to that. We love them all. All right. So a couple things, and then Jen can talk about them too. We are going to send you some handouts. We're making sure they all look great and sending them off your way. My only caveat is I'm sending you pregnancy exercise and I'm sending you some postpartum exercises. If they feel not great while you're doing them, probably don't continue to do them. Let your provider know. That's really important to me because our purpose here is to help you feel better and be the best pregnancy and the best mom that you can be. So if they're not feeling quite right, please don't continue them. They're only out there just to provide care as a good resource for you to help you in the long run. Anything else, Jen?
No, I think we'll just open it up for questions. Allison, I think you're probably going to lead that conversation.
Indeed, I am. Okay, so we just have a couple questions that have been dropped into the Q&A feature, but if you would like to ask a question, you can do that now. The Q&A feature is at the bottom of your Zoom screen, and you can enter your questions anonymously. Just be sure to check that before you submit. All right, so let's kick it off. So question about pelvic floor. What is the relationship between the pelvic floor and the diaphragm? I notice weakness in both and would like to know if there are any post-birth exercises to do at home to support these areas.
I love that question. That's like one of my favorite questions. Whoever asked that, I'm like, I want to give you a big hug. So when you take a big breath with your diaphragm, it descends, right? So your pelvic floor will follow your diaphragm. As you exhale, it will recoil and come back up. So theoretically, when we're doing pelvic floor exercises, we actually want to try to do a Kegel contraction or a pelvic floor contraction on the exhale. So the exercises that I've given you, like the diaphragm breathing and then the coordination with breath with the pelvic floor, are really beneficial for that. But to recap, when you take a breath in, your diaphragm descends, your pelvic floor descends. As you exhale, it recoils. So it's this kind of up and down motion together. And so we'll see people, and we've seen more people with issues, especially after post-COVID, because respiratory issues are occurring, that they're not actually getting their breath all the way down into their pelvic floor. So breathing and making sure you get a full breath cycle is really good. Hopefully I answered the question.
Okay, yeah. All right, next question. So this person says, hello, this is interesting because I've had 2 kids. I tuned in because I want at-home pelvic floor exercises after a hysterectomy 5 years ago. This person is 63 years old. I had some PT a couple years ago because of bowel changes, but I forget what is best to do at home. I know you went over several exercises. Do you have a couple that you might want to highlight for this person?
Okay. Kind of depends on what's going on with them per se right now. Can you read that one more time for me? Sorry. Can you repeat the question?
Yes, absolutely. Give me one second. Okay. So they said they were looking for at-home pelvic floor exercises after hysterectomy and
Okay.
some bowel changes also over the last few years.
For this particular person, the Kegels, but especially like the relaxing in between reps is like really important. But also you may want to consider what's called a reverse Kegel, which we give to people probably prior to delivering to help them learn how to deliver. But basically you would contract, and then so you take a big belly breath. As you inhale, you make your belly big. As you exhale, your pelvic floor will gently lift. And then as you relax, you're trying to almost let your pelvic floor drop down to the basement. If you can think about your pelvic floor is currently at neutral. And if you do a contraction, it's going up to elevator level 1, depending on how hard you contract. If you're going really hard, it might be going to level 4, right? But when you descend for bowel issues, we want to work on actually letting the pelvic floor muscles drop down. And that's also important for delivery as well. So I'm glad that somebody asked this question. But I would also throw out there like an I love you massage if it's a consistency issue, especially with a hysterectomy from scar tissue. An I love you massage will be really helpful for getting things going pretty regularly. So you can look those up. I love you is pretty common on YouTube.
Okay. And I know you said you're always postpartum, right? So is it feasible to—
Just had a baby.
Yeah, yeah.
Just kidding.
Exactly. Me too. My youngest is also 9. I am wondering, so is it feasible to go to your physician, ask for a referral to PT if you think that maybe you have something going on based on giving birth, no matter how long ago it was?
Absolutely. I'll answer that. Absolutely, you can. You bet.
Okay, cool.
And what I'll say is, like, I always encourage those people to come in, but there's almost never going to be, like, we want to make sure there's not other things going on, like the woman that was speaking. We might have had like bowel habit, constipation, medical type things that we can also address for them. But if a patient is coming in with pelvic floor issues, with incontinence, things like that, I'm never going to say, no, you can't go to PT. Like that's always going to be the answer. So don't be afraid you're not going to get that referral, because if you need that, we're going to initiate that. But we're also going to assess, are there other medical things? Sometimes it might also be helpful to see one of our great urogynecologists. So there's a number of other things that might come in to that. But yes, absolutely. At any point, it would be appropriate to reach out to your obstetrician, gynecologist, or nurse midwife for that, regardless of where you're at postpartum.
Excellent, thank you. Okay, the next person is asking, can Kegels ever be done in a harmful way? I'm 6 weeks postpartum and she's not going to be in PT until December. Wants to make sure she's not doing any harm practicing Kegels on her own before the PT appointment.
Most of the time, so I should clarify, and that was a really good question, so thank you. When you do a Kegel contraction, especially for somebody that's really cautious of what's going on, we just talked about how your pelvic floor is kind of at a neutral zone, like you're at level 1 right now, or you're at level 0 right now, right? When you do a contraction, we only really, when you're working with Kegels, you only need to do 25 to 50% contraction. So that's really important, so you're not over contracting through the pelvic floor. And then I always tell my patients, just as important as the contraction is, the release and the relaxation is probably more important, if not important. So make sure that you're taking time to really release in between your reps and sets. And then I think what I normally have people do is I have them start the Kegels first thing in the morning, 1 set of quick contractions, 1 set of longer holds, for once a day. And if they do fine with that, there's no pain the following day, they don't see any aftermaths, there's no issues, yeah, maybe you can do another set throughout the day. But really right now, just focus on gentle, really easy contractions with a full release first thing in the morning. See how you do over the course of the week. And if you're feeling good, add another set and rep on it throughout the day. That's kind of what I advise people to do, just to see how they do.
Okay.
I've got a couple things I want to share about that. Now, I remember being postpartum and trying to do the hold Kegels and initially barely being able to squeeze for a beat. So don't panic if you go to try and do those Kegels even now pregnant and realize I can't hold for 10 seconds. Hold as long as you can and relax. And as you do it more, maybe you can hold for a count of 2, maybe for a count of 3. You're going to continue to build on that. So don't panic. Don't be hard on yourself. If you can't do that full 10 hold, you can build up to that. And then the other thing for me was Kegels are easy to do. They're hard to remember to do. So just trying to find something in your daily life habit to trigger that. For me, postpartum, the easiest thing was the nighttime feeding. Not every feeding, that's a lot of Kegels, but like the nighttime I'm setting you in for bed, that was, you're kind of, when you're nursing, you're not accomplishing much. You kind of feel like, oh, I wish I could be doing this. Well, you're knocking something off your list while you're there. So just in general, trying to find something to build that habit to help you remember to do it regularly is really helpful.
You're so smart.
Next question. Does the pain you describe near the pubic bone area that occurs when going from sitting to standing resolve on its own postpartum, or should I be doing exercises to address it? It has been improving on its own over the last 6 weeks, but I still feel it every once in a while.
Jen, feel free to add your 2 cents on that too. But so typically what I notice with the pubic bones, one of the easiest things that you can do as a small exercise, and I'm sure you found this on the internet already, is just doing gentle squeezes, like pulling your knees together with a pillow in between. So you're just squeezing against a pillow or a ball. If you have kids, soccer balls are fine too. And just squeeze for 2 to 3 seconds, then relax, do that 10 times. And that resets the pubic bones. But typically I see that most of the time, it goes pretty well, as long as there's nothing in the labor and delivery and you feel better after the postpartum period. Jen, do you want to add anything? Do you see that?
No, I think that advice is great. Sometimes that pain is just, we think of the pelvis as one continuous bone, but there's really a joint right there that's held together by cartilage. And the hormones of pregnancy that cause the uterus to relax that help prevent preterm labor can also relax a lot of can relax all those cartilage, all those joints, so you'll have more movement there. So that's where some of that discomfort can come in, which for some people is mildly uncomfortable. For some can be very uncomfortable. Some people will also have a lot of discomfort in their hip joints because with that extra relaxation, they're getting more movement from the ball to the socket. So those are things that are just really important to let us know if they're getting more uncomfortable. Things like hipping, there could be exercises for you to do to strengthen those, that a referral to PT might be helpful, that if you're not getting extra help, it's just going to get more and more uncomfortable. So just reaching out if you're experiencing those. But there's a mechanism of why, but for certain people, just like the diastasis that Jess was mentioning, where some people have more of the elasticity there, where it just might be more problematic for some people versus others.
There's a whole science, but just when you do transitions, one of the biggest things I can tell you, like rolling in bed, try to keep your legs together, getting in and out of the car, keep your legs together. You know what I mean? Like try to not like sitting and try to going sit to stand. Don't do a wide stand up as you're sitting, right? Try to keep your legs together as you go sit to stand and push through your glutes. Super easy things that make a really big difference with that particular diagnosis.
Okay. Can you talk about the muscles or pelvic techniques that should be used when pushing?
So
Jen.
I think, yeah, some of that you're just going to kind of overthink. I think that's more of a learn on the job kind of thing. Learn while you're there. We're going to guide you. But really, you want to be, I think one of the most helpful things to hear and to mentally accept is you're pushing like you're constipated. You know, many people pass stool when they're pushing. It's okay. If you pass stool, you didn't pass stool. It didn't happen. Okay, is kind of the rule of how we handle it. But if you're passing stool, it means you're using the right muscles and you're doing the right thing. So it's quite all right. It's not something to be embarrassed or mortified about. But I think a lot of it is really going to be, you want to think about when you're pushing, kind of regardless of the position, you're going to be curling around. Some people will start to arch their backs or tip their chins up. You really want to be curling around because then you're focusing all that intra-abdominal pressure down and toward the pelvis. And so just like we don't want to push when you're not having a contraction because we want to utilize the uterine muscles along with your pushing efforts, we want to have your body movement also pushing in the right direction as well. And when you're pushing, so this might not totally answer your question, but as you're pushing, the nurses, the providers, everyone's going to give you tons of little tips and tricks. And for some people, I always get worried that they're going to get frustrated they're still telling me corrections. I'm still not getting it right. That's never the case. What we're trying to do is help you make tiny little micro adjustments of instead of holding your partner's hands, grab behind your legs. Instead of putting your chin up, curl around. All these little things that make every push more and more effective than the push before that was, so that we can help you meet this baby sooner. Some people push for a really long time, and it's important to maximize those pushes so you don't run out of energy on that marathon. I hope that's helpful.
The cue I like to use is blow a bubble with your butt.
Yeah.
So blow a bubble with your butt and bloom it like a flower.
Your peas and you're blowing bubbles. I love these visuals.
Good luck.
Okay. This person is asking if they can see a therapist at the hospital after birth so they can get immediate education and exercises postpartum. And then after 6, how to get a referral. And I know, Jen, you addressed that, but maybe just touch on it one more time.
Sure. This is a new program and I am so behind it. I'm so excited about it. There are, like Jess was saying, there's certain diagnoses, like they're going to try and see every single C-section, every 3rd and 4th degree laceration. If we know that you've got really severe tailbone pain, some people will have like a fracture to the coccyx or like a dislocation, things like that. There's certain things that they're always going to see immediately postpartum. But if you have things that you feel would be helpful, you can ask your provider and we'll put the referral in. Absolutely. And we will often reach out to physical therapy, even if they don't meet one of those requirements, to say, hey, I think this would be helpful. I can't tell you the number of people that have just had really severe pain postpartum, that we're going down this wormhole with CT scans and all these kinds of things. And all it's really taking is Priya to work with them once to teach them some breathing techniques and how to cope with pain and doing some readjustments that makes a huge, huge difference when we're going down this huge medical wormhole. So absolutely, the shorter answer to that is you betcha. Just ask and we'll make it happen. They are only right now, she's only during the day, midweek. But also if there's something complex, she's said that we can, send her a text and say, hey, what do you think? Do you have any tips or tricks? But it's a great service. We're so excited to have her there.
Okay. What are some tips on moving from sit to stand safely and most effectively as one gets bigger in the third trimester? I've tried different ways to get out of bed.
Yeah, so like just going sit to stand, you said, right? Or supine to sit.
Yep, and it sounded like getting out of bed as well.
Yeah, okay. So for supine or going sit to stand, one of the things that we commonly give to people is really make sure that you first of all push yourself forward, right? So instead of being back at the end of the chair with your back all the way to the back of the seat, push yourself forward. That's step number one. Step number two is really leaning forward, right? So leaning forward, and then pushing up through your glutes. Does that make sense? So step one, get yourself to the front of the chair. Step two is lean forward. And then you can even push up if you need to through the legs or the bed. And then really push through your glutes as you go all the way to standing. Now, if you're going from laying down, the best thing you can do is roll to your side first if you're on your back. And then when you're on your side, drop your feet down off the bed. At the same time, you're going to push your hand off the side of the bed and lever yourself up. I don't know if that makes sense, but you're essentially kind of levering your feet down as you're using your hands to kind of lever yourself up to a sitting position. So for sit to stand, get to the front of the chair, lean forward as far as you can, push up through your glutes. A wider base of support will give you, so if you widen your legs a little bit, you'll be able to push a little bit easier to get that generation of force for the glutes. And then laying on your back, roll to your side and then push for your hands and then your feet off the ledge at the same time. Jen, you're going to say something? Sorry.
I was just going to say for the lying down from your side, it can be really helpful to take your bottom arm and kind of use your elbow and upper part of your arm and then the hand of the top arm to push both of those up. So you can kind of use both of those forces. Yeah.
And exhale with the effort. Blow out. Blow before you go.
Okay. The next person says they are an ATC themselves and very much appreciate what you do. Currently 32 weeks and have been experiencing mild pubic symphysis pain, especially with squats. Noticing my quads and glutes aren't firing as easily. Any recommendations for working on this pain before delivery?
ATC, I love ATCs. I'm an ATC too. So, obviously a wider stance, I don't know if you're a CrossFitter or not, but a wider stance will open up the pubic bones a little bit. So narrowing your squat as you're doing it will be more helpful. You can even do your squat with a ball between your legs because that will stabilize your pubic symphysis as you're going into the squat. I would mess with your feet placement. And then when you go forward, I sometimes will mess with like either pushing up through the glutes, since you're an ATC, you're following me, I'm sure, glutes, or pushing up through their back. So generating force as they kind of go up through their back. Depends on what kind of squats you're doing, like what high level you're doing, but make sure the narrow gait, I would try a ball even to reset yourself before you even do the squats and then go for the squats. And one thing to try too would be maybe do a Kegel as you're going through the range. So try to do a pelvic floor contraction into the squat and see if that makes a difference.
Okay. This person says, I hear you on trying to avoid just in case peeing. On the other hand, I'm 36 weeks pregnant. I can't walk more than 20 to 30 minutes without having to pee. I often pee when I sneeze or throw up, and there are not always public bathrooms around when I need them. I find myself avoiding hydrating just so I don't keep waking up 3 to 4 times a night. Any thoughts for this person?
Come see me. No, I'm just kidding. So I think, you know, you're in survival mode. Do what you need to do. So don't be too caught up in it right now. Keep yourself hydrated. Get ready for the, you know, do the best you can at this point. Get your sleep and your rest.
Focusing on your hydrating a little earlier in the day might be helpful versus, you know, right before bedtime. So that might help with the nighttime voiding.
And how you're taking your fluids matters too. If you're chugging a whole lot at once, or that will make a big difference. So try to like sip your water throughout the day.
Okay. Older women have descending bladders, and I'm trying to avoid that as I feel changes 5 years after hysterectomy. Same exercises, Kegels and squats. Can I prevent it from getting worse?
You want me to talk or you want to talk?
Go ahead, Jess.
Okay. You can't. So, how do I want to word this? So, you know, I think Kegels are great for this. We really like to do anything. I think the fear is that maybe potentially getting a prolapse, I'm assuming from this person. So, doing some of these, we like bridges are really great for that kind of stuff because they really activate the glutes. So, anything where you get a good glute contraction is very helpful for support, as well as Kegels. And then just making sure you breathe. The biggest thing I can tell you to do is make sure you're breathing when you're lifting and doing. So the number one reason why we see people is we work on breath mechanics. Because if you hold your abdominal wall really tightly as you're doing an activity, it will put pressure on your pelvic floor. So the more you can breathe through your activities, such as like picking up a laundry basket, so blow out as you pick up the laundry basket, that will make a big difference long term.
Okay, and we have one final question here. I gave birth to 8 children. Hips always felt
bless your heart.
I know, so she's my hero. Hips always felt unstable and achy after childbirth. At 52, they are always in pain. Can it be connected?
Yeah, can be. I can't tell you definitively, right? But I could see that they can be connected. We always, when we treat people, we always think of anything that happens at the hips, pelvis, sacrum, coccyx, lumbar spine, thoracic spine. That's like all our domain. We claim it all apparently. So it could be interconnected if there's something going on there. And then if there's like, if you're noticing that you have additional symptoms like incontinence, pain with intercourse, like difficulty with bowel, then yeah, they might be interconnected.
And I'll tell you what, just to add to this, I know hips and knees are not the same, but because Jess and I were working on a project, she ended up seeing me for some knee pain that I was having. And these physical therapists, you guys, are so smart and so knowledgeable and understand every little thing of how you're going upstairs, how you're walking, how you're holding your core, all of those things interplay into so many different things. You know, I felt like I left every day. You mean I don't walk stairs right either? How come no one told me how to do stairs right? How no, you know, it's just amazing. And the things that you will learn about your daily activities, the daily movements that you do that could really help with the pain that you're coping with, dealing with just every single day. It is worth seeing a physical therapist. These folks are so smart, so well informed, and understand all the interconnected parts of our bodies that can really make a huge difference. So I am a huge, huge advocate.
Thanks, Jen.
We
You're
did,
my hero.
Likewise.
we have a couple additional questions come in. Are you guys okay hanging for a couple more minutes? Okay. This is my first pregnancy, and I've noticed when I squat low, usually picking up or grabbing things, there's pain in the vaginal area. Is that normal part of growing the baby? And is there anything I should do differently to work on?
That could be. It's hard to say. I would specifically bring it up to your provider so they can kind of get a whole history on that. But what I do often tell people, I kind of go through a speech of body mechanics that, you know, you want to watch lifting heavy things, but anytime you are lifting, picking things up, I tell people to pretend that bending at the waist, unless you're doing a specific exercise, that bending at the waist no longer works, that spine movement doesn't happen. I want you squatting down, like she said, having a wide stance. If it's anything that is heavy, you want to keep it close to your body. And then when you're getting up, it can be helpful to also have a hand on something to help stabilize you as you're coming up. If there's anything heavy, you want to be holding it close to you. If you have things out, then you're taking all of that weight and putting all that strain on your back as well. So holding things close to your body, and when you're doing that squatting, when you're picking things up, squatting. But pain more specifically, I think it could be just a normal thing, but I think I'd want to talk more with the provider. Jess, do you have anything more that you want to add specifically
That
with that?
patient, I would say try to do it with a Kegel contraction and try it
Mhm.
without a Kegel contraction and see if there's a difference. And that will give you a lot of information. And if it is like not without, it's because you need to relax your pelvic floor as you're going into the stance. If it is like you just need the stability, it might just be for your pelvic floor. Also, we can tell your husband to go ahead and pick up the things for you as well. Throw that out, or your partner. So,
Sometimes the older siblings come in handy with that too, I found.
yep.
Okay, one last question. Vaginal birth 16 years ago with a grade 2 tear. Now continuing with high impact exercises, jumping. Should I slow down as I'm now 45 plus, or can I continue with the same exercises? I have no symptoms or issues, just concerned all high impact exercises can lead to leak or prolapse in the future.
You go
Keep
for it,
up the
girl.
great work. Do it,
Yeah.
Mama. Do
Can I
it.
join
Yes.
you? Fun.
Right. Yeah. Can we come too? Keep up the good work. Glad your
I
pelvic
think
floor
it's
is
just
doing well.
noticing things, right? Recognizing things, being
Yeah.
aware. Yeah.
Yeah. Great
Yeah.
question. Keep up the great work.